Welcome to our webinar. The National Hispanic and Latino Mental Health Technology Transfer Center was established to develop and maintain a collaborative network to support research development and dissemination, training and technical assistance, and workforce development for Hispanic and Latino population and communities receiving mental health services throughout the U.S. mainland and the Caribbean. We also have a school-based mental health, our supplemental project, which focuses on mental health providers serving Hispanic and Latino children and youth. We offer free technical assistance. If you want more information, please contact us. The National Hispanic and Latino MHTTC is under the direction of the Institute for Research, Education, and Services in Addiction, IRESA, and housed at the Universidad Central del Caribe School of Medicine in Puerto Rico, and supported by the Substance Abuse and Mental Health Services Administration, SAMHSA, of the U.S. Department of Health and Human Services. Funded by SAMHSA, SAMHSA strives to reduce the impact of substance use and mental health disorders on U.S. communities throughout its program and services and demonstrate that behavioral health is essential to health. Prevention works, treatment is effective, and people recover from mental health and substance use disorders. You can learn more about SAMHSA by visiting www.samhsa.gov. And now, our moderator.
Hello, everyone, and welcome to today's training, School as a Client, Mental Health Services for Diverse Populations, the School Culture. We have today our presenter, Mr. Scott Bloom. Scott has spent his career at the intersection of mental health and schools, working to improve access to social emotional services and resources by integrating these programs into school system, creating opportunities for students to overcome emotional and behavioral barriers to academic achievement. He is the founding director of School Mental Health Services for the Office of School Health in the New York City Department of Education. The School Mental Health Unit facilitates partnership with mental health organizations, implements major tribe NYC projects, and focus on prevention initiatives that have created a citywide system of mental health services and resources in over 1,800 New York City schools. He has been working with children and families for over 30 years. He serves on the advisory boards for a number of cities, states, and national mental health initiatives, including the Center for the Advancement of School Mental Health at the University of Maryland. Mr. Bloom has contributed to journals, magazine articles, book chapters, and has presented at local and national conferences on school mental health. He's also certified as a psychotherapist and a private practice in supervision in New York City. We thank our partners, the community partners of South Florida and the Florida Atlantic University School College of Social Work and Criminal Justice. We want to remind that our activities are uses affirming, respectful, and recovery-oriented languages in all our activities. This presentation was prepared for the National Hispanic and Latino MHTTC under a cooperative agreement from the Substance Abuse and Mental Health Services SAMHSA Administration. All materials appearing in this presentation, except that taken directly from copyright sources, is in the public domain and may be reproduced or copied without permission from SAMHSA or the authors. Citation of this source is appreciated. Now we will have a poll question, so take it, Cindy.
Thank you, Christina, and welcome everybody. Our first question of the day is: learning the language of a school is important because you need to understand its value, culture, and infrastructure. It's a true or false question. And 100% said true. Our next question, allowing teachers to vent as much as they like can help to get students referrals. Once again, true or false? And 29% said true, 71% said false. Our last question. Mental health providers need to understand that Hispanics require additional outreach to engage them in services. Once again, true or false? And 97% said true, 3% said false. And now without further ado, I'm going to leave you with our presenter, Dr. Scott Bloom.
One second. Okay. Hi, good afternoon, everyone. Thank you for having me here today. I'm looking forward to working with everyone as we look at the school as a client and look at some of the concepts of how to bring our clinical work into working with schools and looking at the school as a client and how to work with them in terms of the languages. So today, I want to go over first the learning objectives, the new paradigm for school mental health, really how to conceive school mental health as an academic support, not just as a student support. Look at the concept of school as client and how that plays out working in the school on a daily basis. Kind of get then into the nuts and bolts of what we do and how we get to do that and working with our community, school community relationships. And finally, something that we certainly don't want to push under the rug is the impact of COVID-19. And I've been asked by the Mental Health Technical Transfer Center to talk about some of the initiatives that we've implemented in New York City and somewhat similar across the country because of the impact. And let me say, I hope everybody is safe. I hope everybody is well. I understand we're all under lots of pressure and uncertainty, and this new school year is upon us in a few more months. So I hope you will find this presentation very interesting. We will have time for questions and answers. If there are questions that come up, please feel free to put them in the chat. I have Cindy and Christine who will be helping me guide some of the questions. So if I don't answer something, I will certainly have time to do that at the end. Okay, so some of the learning objectives, they're pretty straightforward. Just want folks to know this is not going to be a clinical presentation. I'm not going into treatment modalities or clinical modalities. However, there are a number of our clinical knowledge and skills that we have that we can use when working with teachers, working with the school community, and working with schools in general. So I just want to identify key historical contexts that frame school mental health, recognize the areas of tension and conflict between multiple systems. I work in New York City school system. There's 1,800 schools. It's a very complex system, as you can imagine. New York City is always under the microscope, so the things that we do and how we support our students is very key and very important. How to articulate the best practices in collaboration. It's really about relationship building and sustaining those collaborations throughout the school year. And finally, the kinds of resources or tips I'm going to get, it really helped you to create a toolbox of strategies to promote positive presence in schools by interacting positively with the school staff. We know that's not always easy because there are so many different agendas going on any moment in school, any given day. So why is students' mental health important? I think some of these statistics, some of them are a little older, some of them are brand new, are important. And I thought I wanted to give you sort of a combination of the kinds of issues that you probably already see in schools. I know we certainly do. Growing and unmet need for mental health services in children and youth. Folks that need services don't always get them, and schools often is a place that we can get those services. Among 2.2 million adolescents reported a depressive episode in the last year. Nearly most of them didn't get any treatment, and that's a real capacity issue in some of our communities across the country. A recent national survey found that 46% of LGBTQIA youth reported they wanted psychological or emotional help from a mental health professional, but were unable to receive it in the past 12 months. There are long waiting lists. In New York City, it's typically 6 to 8 weeks of getting an intake and then another month or two to be seen by a mental health clinician in the community. I'm being told right now it's more like a 6-month waiting list, and that's a systemic capacity issue. I don't know how it is where you are, but it's really something to think about in terms of where do we as a society put the services for students. Crisis results show that nationally, Latina LGBTQ youth were 30% more likely to report suicide attempts, according to the Trevor Project research brief. And they're twice as risk of attempting suicide. We know this from a lot of our work with the Latino population for a number of reasons. I'm not going to go into now, but I know the Mental Health Transfer, Technical Transfer Center has webinars and information on that. So if you're interested, our hosts would be more than glad to send you some of the webinars that have already been done looking at suicide in Latina youth. Of course, even, just the other day out in California, there's shootings at factories, school shootings, 9/11, hurricanes. There's always these, what I would call larger universal crisis and emergency situations that happen. And that's where we do a lot of preventive work. But often when the crisis is over, we can do post-vention work. When all the crisis staff leave, we can be there as school mental health social workers and school mental health clinicians. And finally, national Latina high school students attempted suicide in 2018 at a higher rate than their white and Black female identified peers. So again, the Latina population is very important in terms of understanding the culture so that we can come up with the right intervention for the right student at the right time. One other thing that I'll say before we go on, sometimes I'm going to interplay both school social worker and school clinician at the same time, because I know many providers out in the communities come into schools, and then we have on staff at the Board of Ed or the Department of Education, the school social worker, guidance counselor, SAPIS worker, and other kinds of support staff. So I'm going to be using those terms intermittently. Another statistic here that I think it's important to show, in 2016, we have that label, which I'm not so fond of, serious emotional disturbance, or SED. We often find these on IEPs. again, we will see that the Latino population and Hispanic population are more in terms of depressive disorders, conduct disorders, adjustment disorders. Again, a rise in that, so we want to be able to understand and target services for students. I assume folks are familiar with the YRBS. It's a Youth Risk Behavior Survey. It comes out every 2 years from the CDC. And the next one actually will be this November and October. They'll be surveying high school students across the country. I know in New York City, I think the minimum is over 3,000, somewhere in the 3,000, 3,500 range of high school students to show significance. And it's 120 questions about their health, their safety, what issues are they dealing with as an adolescent. And there's always about 5 or 6 questions that deal with mental health and emotional health. And again, we can see here that compared to white non-Latinos, Latinos feel sad or hopeless, a larger percentage, and particularly, again, the Latina females. Attempted suicide, those numbers are also up. So it's important to again, while suicide is the second leading cause of death for all youth and teenagers across the country, it's important then to focus in and create specific prevention interventions for our Latino and Hispanic population. So just if you can put into the chat box, since I can't see you all here, is why do you think mental health in schools are important? If you can put that in the chat box, 1 or 2 words, that'd be great. Then maybe Christine or Cindy, you can read some out. Oh, sorry. Okay, I don't see much here right now. So remember, there's the chat box below. So I'll just move along here. Right, schools are the local point of entry. Schools are frontline education. They're more natural settings for students. They spend over 180 days a year in schools. By being in schools, there's increased access and follow-up. It closes the treatment gaps, particularly for students of color. Important role in mental health campaigns. And for many of our schools, it's the sole provider. Our nurses, our registered nurses often are part of the primary care for our students. Our social workers and mental health workers are often the primary mental health workers. And so often the health issues of our students are gone through the schools and are part of their primary care. All right, let's try this one. See if we can put that in the chat. Why do we need mental health in schools? How does mental health affect student achievement?
Scott, for the first question, we got some answers. Accessible to most students in need, only point of access for some.
Right.
Another mentioned access. It is accessible. Kids who may not feel like they can share at home will be able to ask for help at school. It enables patients to get the best learning process available. School is a safe place for some kids. Yep. It enables students to get the best learning process available.
Right. Now,
I love mentioned Maslow hierarchy.
Okay.
Hierarchy.
Great. Thank you for that. Yeah, I can't see them, so that's okay. But I love the idea. I mean, one of the themes that I'm picking up that you all are putting in there, that schools can be a safe space. I mean, why do you think before, summer recess, kids are, their energy is up? Well, part of it is, yeah, no more school, I can get out. And I'm talking about a typical year, not this year, but also for many of the kids before a vacation, before a long weekend, before the holidays, their anxiety rises because they know they have to go back to a home life which may not be safe for them. They feel they can't be who they are, or there are lots of pressures and stress in that home life and that family life where they live. And so school, that sometimes kids won't even admit it, but school is actually a safe space. So from a clinical point of view, it is a containing function for them. We can hold on and we can contain their anxieties, their wishes, their fears. And, sometimes when I worked in the school as a school social worker, kids would come into the clinic, the space I was working with, or down the hall, give me a high five and so on. Or they would check in, and days I weren't there, they're like, what happened? Where's Scott? Why isn't he? Because I was a constant object for them. I was somebody who always treated them with respect, maybe disagreed with them, but somebody they felt they could talk to. And when that safety net, even in representation as a person, is not there, it can cause some anxiety for our students. And so from the larger, maybe more macro point of view, fewer referrals based on challenging behaviors, special ed, decreased disruption from classroom and school activities. Teachers love when there's more teaching and learning time, and there's more increased confidence about mental health from teachers. Often teachers are our first responders, and they don't always buy in what we're doing. So we'll talk more about that. I'm not going to go through the chat because of time, but you probably all know this, but it's important that students benefit from having more mental health on site because it's an improvement in student decision-making, school culture, and commitment to school. We talk about school climate, positive school climates. We want to engage students. We want to make more connections to students. Certainly increased knowledge of mental health. The more the knowledge of mental health and awareness of it increases, stigma of mental health decreases. And we know there are different cultures and different family values that come into play when we're talking about mental health. Some families say, oh, it's none of your business. We don't talk about those problems outside. Or because of religious beliefs, spiritual beliefs, how families deal with their problems, their stresses and psychological issues often start to get into the schools. So for the first 5 years of their life, you have, the Gonzalez family, the Bloom family, the Smith family, and that's our family values. That's the way we discipline, the way we show affection, the way we interact with each other. And then one day we go to PS 101 or the Little Red Schoolhouse, but that schoolhouse also has their own values, the way they show discipline, the way they show affection, the way they reward, the way they punish, interactions. So you have two values that are bumping heads against each other. And I think sometimes our school community doesn't quite understand that when a child comes into the school, they're also bringing with them all those issues from home. They just don't close the house door and go into the school door. So that's part of learning the language of the schools and how they address these issues. I want to move into some major points here. One of the major points that I've really worked on and try to get across to everyone in partnerships and collaborations is that school goals are mental health goals, and mental health goals are school goals. And often academia separates them. There's pedagogy, and then there's you doing the school support work, right? It's like when you go into the eye doctor and he says, okay, read the sign A, B, C, D, E, F, G, and then covers the other eye, A, B, C, D, F, G. So just think like one eye is academia and pedagogy and the other eye is mental health. The idea is that we want 20/20 vision on this. And that's why school goals are mental health goals. And it's our job as school social workers to ensure that schools understand that, because the more they understand it, the more they'll accept you, the more they'll trust you, and the more they'll trust your judgment as the mental health expertise. The second point, improving contexts as a mean, right? What's the context? The context is schools. The kids are in a classroom all day. It's not like you're doing home visits, which is a wonderful thing to do if you've never done that before, or an emergency visit, or in a community mental health clinic, right? It's pretty much you shut the door and for 45 minutes, that's it. You are in the context of a school. So in a classroom, so that's why there are lots of evidence-based interventions, group work, advisories, restorative practices that take into account the context where the kids are. And where are they? They're in the classroom. So you can't do 45 minutes of psychotherapy in a classroom, but you can do various kinds of curriculums, right? So these are effective and feasible ways to support children in classroom context. You know, often I get into that discussion with principals. You can go to any principal in this country, they'll tell you what we want. Oh, we need a clinician, we need to do DSM-5, these kids are crazy, you know, they're climbing up a wall. What they need is not always what they want. And it's our job to help them understand the context of the school and, in essence, what they need, right? So let's go right to the chat. Let's go to our chat box here. And I wonder if you can just tell me one type of intervention or program, doesn't have to be mental health, could be something else like music, that overcomes barriers to academics. One type of intervention or program that helps students overcome barriers to academics. And then if you can start reading them for me as soon as they come in.
Okay, we are monitoring.
Sure. Again, it doesn't have to be mental health. It could be music, a good lunch.
Art, lunch programs, music and sports. We dine together. Social emotional practices, playworks, leadership opportunities during recess, reading and math tutoring.
Right. Remedial academic help.
Okay.
Okay.
Athletics, school clubs.
Absolutely, athletics.
Anything that provides transportation for those that do not have it.
Right, right. Transportation. Yeah. Great. So all the things that you're talking about, we've seen a lot of science and a lot of research to show the efficacy of nutrition, health, vision services, and maybe it's something like this. Right? Phys ed, special ed, violence and crime prevention, social servicing, pregnancy prevention, mental health services, drug prevention, school lunch, nutrition, health education, after school programs, a must if you want to do resiliency work. So often schools will have everything. And so what do? How do you, if you look at these, you know, which one wouldn't you want to put into a school? So what we get from our school community is, you know, if I get one more email telling me that I have to put in a, you know, violence and crime prevention or, you know, drug prevention, or this is a school, this is not a social service agency. Well, times have changed. And that's why you all as mental health experts really can work with the school as a client to help them understand their own needs. Because if you've ever done individual work, most patients come in and they say, oh, I broke up from a relationship, or, you know, I lost somebody, or I'm not feeling very well about things in the world. And then it takes a number of sessions to find out why they really came in, right? That's the manifest level is, oh, I broke up with my girlfriend. The latent level is, I can't keep any relationships and I don't know why, and I feel so lonely. But they may not get to that until the 3rd or the 5th or the 10th session. Same thing with schools. Come on in, I need you to do this, do this, do this. But they may not always know what they need, right? So again, as I mentioned before, the first thing of schools, they're there to teach, hopefully doing some critical thinking and teach. And they base themselves on test scores, grades, productivity, time and again, right? It's about reading and writing, and it's about the child's learning. Then again, on the other side of things, we have the mental health, emotional regulation, relationships, adaptation, and coping, right? So kids are struggling, but if they're struggling with their mental health, if I anticipate I'm going to end up in a fight, or I'm anxious because I don't know if my family is safe tonight, or if I just was put into a foster care system, they can't think, they can't comprehend, they can't concentrate. So their mental health issues affect their academic issues. And if we go on the other side, right, I can't do the test scores. My vision isn't great. I'm not time on task. I can't do that. That's going to affect, I feel so much pressure. If we talk to teens, that's one of the top 2 issues, the pressure that they feel, so that the academic and mental health arrows, I don't care where you start, they're both interconnected, and that's going to cause success in schools, so that clinicians start to see how academic achievements are tied to mental health issues, and that teachers start to see that mental health issues are tied to academic issues. It's a real important idea here. So again, what we're trying to do is reframe mental health. And in my own iconographs here, I want you to start thinking about student supports as learning supports. Because if you call up Mrs. Jones, as Mrs. Jones, you know, Johnny is spitballing everybody. He threw a chair 5 times today. He threw a Jenny in the closet and the coat closet and locked her in there, and you better come in and pick him up. The mother says, so what else is new? I've heard it before, you take care of it. But if I call the same parent and say, you know, Mrs. Jones, Johnny's just not concentrating in math. You know, he's a great student. When I see he does well, he puts in the effort, I see he studied, but he just can't concentrate. I wonder if you can come in and help me with this, because I'm kind of out of strategies here, right? There's a difference. When you make the academic issues and you connect them to the mental health teachers, principals, deans, parents, who we really need to help work with us, they're the ones that are going to see the benefit, that if we can help with concentration, comprehension, that their academic achievement goals will go on the rise, and they're going to feel better for it, and so will the school. It becomes more of a positive. So just want you to know that. Again, when we mean by school client and school climate here, if you take a look at 2 approaches, and let's start with the one on the left here. Student argues with family before the school, now they're running late. So let's go to the top half, right? Student arrives at school. Hey, Scott, glad to see you today. Oh, you look, you okay? You look kind of out of it a little bit. Oh, the bell just rang. We'll get to class. Hey, have a great day. Teacher welcomes the student to class and waits until after the class. Hey, what happened, Scott? What's going on? Oh, something happened at home. Well, tell me about it. I have a few minutes. Let's talk about it. Student has a fight in the hallway. And so as they have a fight in the hallway, the fight is properly de-escalated. The students participate in mediation. And then finally, later that afternoon, they try to work something out, right? That's an alternative to discipline by doing more of a restorative justice or restorative practices. But if you take the same thing, you start again on the left and you go on the lower level. Student is greeted by a metal detector and unwelcoming staff. Student is late to class. The teacher scolds the student in front of the class. That's a sure way of losing any trust to that teacher. Student has a fight in the hallway. The fight is not de-escalated. Staff are unsure what to do, and so they call 911, and then that student is remanded and removed by the school police. Now, needless to say, which one would you want at your school? And I hope if we did a poll, it'd be 100% of the top. That's where we want to get to, and that's where we want our schools to understand that discipline and suspension, there are alternatives and better ways of making positive school climate. And that leads us to our theme for today, school as client. Again, when we work with our clients individually, they always come in with a presenting problem. We do an assessment, a screening, an intake. We create a treatment plan, and we also then begin to learn the language of our clients. So they say, I just broke up with my girlfriend, and how was that for you? Oh, it was painful. Your definition of painful is different than my definition of painful. Your definition of, it sucked is a lot different than mine. I have no idea what they mean. I need to learn the language of that client. It's the same thing here with a school. We need to learn the language of the school and understand as a client, what are their needs? It's not just the individual kids we see. If you're doing that, you're only doing half your job. The whole job is, okay, let's take a step back. And if this school was a patient, what diagnosis would I give it? What's the pros? What's the cons, right? And the first thing we look at is a presenting problem. What brought you here today? What's been going on, and so on. So like any client, each school has their own reason why they're receiving your services, what they need, right? It's always important to get a sense of the problem from them. So sometimes I'll say to a school, bring me all your support staff, and I go to the meeting, it's the principal and one other person. So, wow, okay, not here to judge, interesting. I'll go to another school and I'll say, okay, I'm meeting with you tomorrow, bring me all of your support staff, who you consider. I'm not gonna tell you. And there are 15, 20 people. There's the parent coordinator, there's the nurse, there's the hall monitor, there's the PTA, there's a lunchroom. Wow. So even that tells you something, the perception of what they think of in terms of support staff. So we really want to know, when you meet them, what's the urgent need? How do all the stakeholders view the problem or the mental health problems in there? Let's understand their sense of it, right? And once we start getting a sense, and there are different tools you can use. There are, like you would do an assessment for a client, you might do an assessment. And one of the ways of thinking about an assessment here is some kind of gaps mapping. This triangle, you've probably seen it in different versions. It's a public health model, so that there's primary, secondary, and tertiary prevention. So there's universal, selected, and targeted interventions. And I'll go through them very quickly. Universal interventions, this is for every student in the school. These are, and how do we do that? So there may be anti-bullying programs, PBIS programs. For teachers, it might be trainings and personal professional development. For parents, it might be workshops, parent chats, resources linking to the neighborhood. Those are all universal interventions. The second one is selected interventions. That means these students are selected to be in these interventions, like group work, crisis counseling, advisories, restorative practices, circle work. We want to see that. And finally, students with intense problems, those with targeted interventions. That's when you're doing your DSM-5, your individual crisis counseling, group work, or parent work. So you would start to do an assessment of that school. What do you have in universal? What do you have in selective and targeted? Sometimes schools do it electronically. Sometimes I'd go in there, roll up my sleeves and have some kind of handout so I can start to see who do you work with? What do you do when there's a 911 call or a call, report for abuse and neglect? Who's on your staff? What are they? And then after you do the assessment, you'll get a pretty good idea where the gaps are in that school. And once you have the gaps to that school, you can start to say, okay, what's needed? And here's a nice iconograph of it, where the social worker would stand, where the students' problems are. So you'd have school-based, again, prevention and universal intervention, suicide prevention, mental health campaigns. It's, May is Mental Health Month Day, Teacher Appreciation Day. And as you start moving up the triangle, you'd have early identification, kids who are at risk for dropping out, abuse, neglect, failing, or at risk for their mental health issues to become more acute. And then again, at the top of the triangle is where you'll have your kids who may need to be referred to an RF, a residential treatment facility, or an outpatient mental health clinic, or if you provide DSM-5 types of intervention, evidence-based treatments, individual, collateral, that's where you would do that. So it starts with a school assessment, and then you want to start to plug those in depending on what resources you have. And often with doing that assessment, what services the school has and how do they leverage those services, which brings you to a treatment plan. Just as after you're working with a student or you're working with a client, right after, a number of sessions, you'll say, okay, here's the treatment plan, here are the goals, here's the objectives, and here's what we want to see in 90 days. In 90 days, 3 months, we want to see some of these changes, and here's how we're going to do it. So the treatment plan is a bit of like a trial and error. This is a long process. It can take 3 to 6 months in terms of the whole school, right? Particularly if you're a social worker from an outside agency, you want to find ways, as it says here, to become the fabric of the school, so that if you're an outside agency, you are anyone working with you or anyone meeting you for the first time because of your services, they can't tell if you work for your Department of Education or you work for an outside agency. So that's something that you go to all the PTA meetings, you go to school night, parent night, you go to the plays, you are there, and we'll talk about that, how to become a public relations expert. That's something that when I hire social workers in schools, that's what I look for. Wallflowers, people staying in their offices isn't going to do it. You really need to be out there. And so something that I coined called stairwell therapy. School social workers have to be in the hallways. Your presence has to be known, because if they don't see you, you don't exist. So being in the hallway, you say, hey, Johnny, saw you the other day. Hey, Monty, hey, I saw that basketball game. Give me a high five. How'd you do on that test? Right? You're not breaking boundaries. You're relating to them as, students in the school, and they appreciate that. They want to be listened to, and that's something you can offer. So by saying hello, finding out how their day was, just a quick opportunity. And when I say stairwell, hey, come here for a second. How did that thing go? It went well. Okay, great. I'll see you Tuesday. Don't forget, bring your lunch. It's a connection. You become that constant object in their life and someone that they really trust, right? So it's important also, like I remember the first time I worked as a school social worker in a junior high school, I forgot the energy, right? You ever walk down a hallway at 10:30, bell to bell in a junior high school? It is maddening. And then when I would take the subways, and I'd see, you take a subway in New York City at 2:30, 3 o'clock when the school's let out, the kids are running down the subways, they're all yelling and screaming and drinking, and at first time I was like, oh, I finally made the connection. Oh, right, I forgot what it was to be 13 years old, 14 years old, and all that extra energy. and this is where it's going. So learning about the school and being part of it is extremely important. With any school or with anybody you're working with in the work and the job market, there are various stages of development. And this is also part of the treatment plan when you're working it out. This could take 3 months, 6 months, sometimes even a year, right? And a simple way of remembering it is form, storm, norm, perform. I really like it. It's very quick. Form, storm, norm, perform. What you're doing in that assessment treatment plan is you're coming together to understand the school's needs. Where are the gaps? What do they need? First phone calls, orientation to what you do, what you can do for them, and what you can't do for them. That's often left out of the conversation. This way you have your guardrails and you don't go over the rail, because if you go over the rail, you're going to crash. Storm. It's that period, the storm period, is the trial and error. Is this working out? No. You didn't make that meeting. Okay, I'll come to this meeting. So you're hashing it out. It's not always easy when schools got 100 things going on. We'll talk about that in a moment. So you may be brand new to that school. So it's like two people meeting for the first time. They're suspicious. What are you going to do for me? How's this going to work out? That's the storm. But after you start doing the work, you start to get that relationship. And sometimes it's after the first crisis situation when a teacher comes down and says, thank you for helping out. Thank you for coming to my class. Now I know what you do. And that's insight. That means the school, like a client, is starting to internalize your work. And like in therapy, when I said, I'll say to my therapist, I was thinking about what you said the other day. That's gold. When they stop me in the hall, hey, Scott, what you did with Johnny the other day, that was great. I really thought about it. So then you move into that norm position, right? You start working together to accomplish tasks and build trust. Hey, I'll get it next time. I'm following up. I'm getting back to you. There's no surprises. I let you know what's going on. Again, I become a constant object for that school. I do it for the student and I do it for the school. They know who I am. They know my name. They know where to get me, and I follow up. And finally, it's the performance. And this is sometimes, with social workers, we don't always do is celebrate our successes. So by meeting regularly, using data to show, hey, decrease in crisis situations, increase in knowledge about mental health, or identifying referrals. I am linking the success of my mental health program to the success of the school, to the success of the academic achievement. Again, academic goals and mental health goals are combined here so that we are becoming, again, that reliable, consistent, safety, predictability person, object, a la Winnicott, if you remember your developmental psych, for that school, and certainly for the kids. And finally, for this component here is learning the language. This is the favorite, and this is the one that has sort of organically came to me, because there was a missing piece here. And as I mentioned earlier, just like you work with your client, we have to learn the language of the school. We have to understand that school's culture, their values, how they communicate. One of the wonderful things I used to do is go into a principal's office, and you go into a principal's office and there's some that are pristine. They have all the trophies in back of their cases, their certificates of graduation and their PhDs are up there. They wear suits and ties and dresses, and it's like a CEO. So I realized, I'm working with the chairman of the board. Okay, I have to talk to this person as if they're the chairman of a Fortune 500 company. And then I walk into some principal's office and there's a crisis going on all the time. Oh, thank you, have a sit down. Oh, wait, well, let me get this. Oh, wait a minute, someone didn't show up today. I have to, an announcement in period 5 today, it's canceled. What was it again? Who are you? What are you? So I'd have to say, hey, Scott Bloom, School Mental Health, I got 5 minutes. I just need 5 minutes of your time. I want to tell you what's going on. Here's a flyer. So I have to learn the language of the school. It's like when you go into a school, and you've done this, a new school, you get a vibe, as they say out in California. Hey, there's a vibe here, right? It's bell to bell and it's quiet. Or you're walking down the hall and it's 11:15. It's quiet in the hall. Something right is going on here. Something good is happening here, right? I remember going to a psychologist's office, and there was a sign and it said, "Nobody gets to see the wizard. No way, no how." And I said, "Wow, what a message that is. They're turning people away." I said, this school needs PBIS. And guess what? I walked down the hallway and there was a big sign, "Hey, welcome to our PBIS, event coming." That's the language of the school, and that's something that's not taught in social work school. We learn about the language, we have to sit in somebody's moccasins in order to understand how they see the world. It's the same thing with the school. And if you don't do that, again, you're missing half the ability to really serve that school and understand them in ways that we get to know about them. It's part of the reframe that I talked about earlier. I just want to pause for a moment to talk about the Hispanic and Latino population, and you really need to do that for all the populations that you are working with in your communities, whether it's Asian Americans, it's folks from the South African countries, people from all over the world in the different cultures, people of color. It's important to understand some of the nuances and how the culture understands mental health, understands family problems and issues, and where they go typically for help, and how to in some way start to market or focus your services to address the populations. And certainly with Hispanic and Latino populations, respect and engaging the families is paramount. How you approach them, how you honor them, how you respect them. I know going into many Hispanic and Latino families, apartments, when I do home visits, I was fed. I was a guest, please sit down. And so to return that respect and understand it, I think it's really important. So developing those relationships with the key leaders in the Hispanic and Latino community are very important. Understanding the clergy, the spiritual leaders in Espiritismo, and how much that has an effect on the culture. One of the things, interesting, when I worked in Washington Heights in New York City, it was a large Latino, mostly Dominican population. It's mixed now. One of the parent coordinators used to have cultural events for parents. And she said to me, "Scott, I want you to come down at 2:15 tomorrow because I want these parents to understand, because a lot of their kids are having test anxiety." So I went into the room and they were making flower arrangements, beautiful, gorgeous. And they said, "Oh, look, Scott Bloom is coming in. Scott, why don't you come and say hello to everyone? I want to introduce you. Scott is like the director of mental health at the school. Scott, a lot of the parents are having issues with their kids because it's exam month." And so she was able to get me incorporated into the culture. And that's really thinking outside of the box. And we actually created like a 6-part series of mental health for kids from a parent's point of view. And they got certificates, they put them up on the walls, they showed their kids. It was really wonderful to do that, right? So the second part is to understand here, to take time learn about the Hispanics' country of origin, how history plays an effect. I think that's also important here. There are 20 different countries around the world. Some of them share common characteristics. They could be very diverse, very proud individuals. So we want to understand, some of the cultural differences that you might be dealing with in the schools. The third part here is taking time to educate about mental health issues, right? So again, here is looking and helping to raise some awareness about mental health from a cultural and linguistic point of view here. Looking at consumer satisfaction, we want to eliminate dropout rates, connecting often the academic issues to mental health, so that often Hispanic and Latino parents will want to see you more readily because you're talking about academic issue. And then you would subtly bring in the mental health issue and talk in a way that has to do about stress, has to do about pressure, and ways that we can work together here. There can be a lot of fear, there can be a lot of distrust. That's why often Hispanic and Latino families don't want to sign consent forms, because it may be because of immigration issues, family business. Is the government going to come after me? It's been a lot of fear and a lot of distrust. So many families used to bring documents in for me to read them. And what started to happen is they started to trust the folks in the mental health clinic more so than the school community. And then we would bring them along to the school because we took time to listen, to understand. And then finally here, don't misinterpret quietness or shyness as depression, right? You know, each culture plays an area, presents different symptoms, helping, seeking behaviors. A Hispanic woman might look down, be very quiet, be very shy. Doesn't mean they don't want to cooperate. Doesn't mean that what you're talking about is important, but this behavior is culturally acceptable. So just as we're learning the language of the school and working with a principal who is in crisis all the time, or one who is laid back, we want to be able to work with folks from different populations, and in this case here, the Latino population, the Latino and Hispanic population. I'm just looking at the time here. We talked a little bit about trust. I want to make this point. I think it's really important. There's always real time and versus school time. Real time here is, 3:53 in the afternoon, but then there's school time, and school time is yesterday. School time is, oh, there's a meeting, there's a crisis going on. You show up for your meeting, you're in your tie, you're in your dress, and you're there, and nobody else is there. Oh, sorry, we forgot to tell you we had a PD today. Oh, we forgot to tell you the school's actually closed because there's a new holiday. Oh, didn't you know that so-and-so retired? There's real time and there's school time. Real time is always this emergency and a lot of drama, and school time is always like that. So it's important to understand, going back to the culture of the school, how they deal with time, how they deal with issues. And social workers, we need to be flexible, like work with our clients. Just think about working with a school like a large family. It's very complex, and there's a family system. There's the enabler, there's the one who acts out, there's the one who allows things to happen without any discipline, there's the one who disciplines too much. Again, there's real time, and then there's school time. School time is never real time. And to work in schools, I would say, as we say in motivational interviewing, unconditional positive regard. We have to be able to let some of these things go and be able to tolerate some of the behaviors that school staff may have. I'm not saying you have to tolerate everything, but we have to deal with some of the conflicts that may emerge. So let's move into this part of the presentation. So we're in school time, and often school times could be crisis situations, right? The impact on school staff, time for collaborative activities. You want to take a kid out of class, they want to teach the kid. How do you deal with that? They say, hey, I need a social worker up in my classroom now because a kid is throwing a chair. Well, if he's throwing a chair, that's a discipline problem. If he throws a chair more than 3 or 4 times in a week, that may be a behavioral pattern we'd want to look at. So sometimes it's teaching the school staff about the various conflicts and how to address them. So one of the effective ways, and here's where we start moving into more of the toolbox, the effective ways to communicate with the teacher, I call it intervention versus interference. One of the things that we as social workers have to communicate all the time is how it's going to be beneficial to all involved. You know, what's in it for me? Why do I have to do this? Who are you today? You know, that may be the attitude the teachers give you. So we have to say, you have to go in with the benefit. What's the win-win situation, right? What do I do if the teacher is unaware of the problem? Just like you might do with a client. You're going to ask general questions, and then you're going to gradually move into more focus and focus in on the problem. So you are asking them for help. You're asking them to help you in order to help Johnny. And if I help Johnny, he's not going to act out in class, right? I'm going to help all around. So we want to get that. The teacher gets defensive. They respond as intrusiveness. How do we be empathetic, right? This again goes back to our motivational interviewing practices. How do we become empathetic, having some distance to see what they're going through and get into a conversation with them? Sounds like the problem hasn't given you the ability to, help Johnny, or it sounds like you can't teach the rest of the class if Johnny is disruptive, or it sounds like, yeah, some kind of connection you want to make so you can start to bring them in and help them help you to help Johnny, right? Suggestion versus criticism, right? We all take things personally. I take things personally. You take things personally. So how do we say it in a way that's not defensive? I noticed the other day that, it must be difficult with 30 kids in your classroom. I mean, I don't know how you do it. That's amazing. I would be yelling and screaming all day long. How do you do it? Oh, well, it does take some patience. Yeah, you really need patience to do that. Yeah, so how do we show that to like one kid like Johnny who needs his help, right? How do we move them away from the criticism? I always say, don't take it personally, because they're not angry at you. They're projecting onto you. You're going to help Johnny, and what about my other 29 kids? You're going to help Sally, and what about my... So we have to use our, in terms of transference and the countertransference in our clinical work, how to deal with that and understand it is a projection of their helplessness, their hopelessness, their exhaustion, their burnout. Try teaching a class 5 times a day, 5 days a week, 180 school days. It's a lot, right? We want to acknowledge it. We want to say, yes, I hear you. Yes, I acknowledge. You know what? It seems we disagree on this particular issue, but let's see if we can work together for Patty. I'm out of strategies. Help me. I'm a lonely social worker. Help me out here. It's okay. I put myself in a one down position. I don't lose anything by it because it's all about the student. Synthesis versus metamorphosis. Look, change is never easy. That's a whole nother presentation about change, but it says just like students, teachers need to feel that other school personnel support them, recognize their assets, work with their challenges. We want to capitalize on a teacher's positive behavior. Hey, you did that so well. How did you do that? Tell me, because I want to tell the rest of the teachers what's going on there, right? Teachers need to feel that other school personnel are picking up on the importance. I see for time, I want to spend some time on this and then I'll move on. Clarity versus chaos. Here's where you become the public relations expert. Teachers are often confused by the actions of the school social worker. I always say you have to explain your role again and again and again and again and again. That's part of being a social worker in a school. And if you don't know it, you're going to find yourself with a lot of challenges. So when I hire staff, as I said earlier, I hire them for their clinical acumen, their ability to get on an adolescence level or an elementary school child's level, but also their ability to market themselves, to brand themselves. You're brought to the table whenever a problem arises. You understand that there's conflicting agendas, but you help them to do that. And how do you help them? Because you understand what their system is. They're there to teach, they're there for pedagogy, and we are here to mental health. And as you're becoming aware of how those academic challenges are also mental health challenges. And I'm sure each of you, if you took some time and thought about it, if I could break you up in groups, we'd come up with a whole plan of action for some of the schools that we work in. Top down and bottom, right? Teacher, staff, respectful. I'm sure you're all doing that kind of thing here, but it's important in orientations and so on that we show our respect to teachers. Again, keys to effective communication. I can't emphasize this enough. If you're not doing it, or your director or supervisor isn't helping you out, you're missing a lot of ability to make it a more positive and positive school climate. Feedback, orientation, screening tools. I used to put all the screening tools, and I put some Hershey Kisses or little bags of Skittles and tape them to it and paper all the teachers' mailboxes. Teacher appreciation. I used to bring in drinks during a lunchroom once a month and talk about, how to make a referral, what's an appropriate referral and what's an inappropriate referral. Explaining my role time again, showing appreciation. Oh, March is social work month, May is mental health month, October's AIDS awareness month, November's teacher appreciation month. There are so many things that you really could do on a monthly basis. Put up your pictures outside the wall of your office, what your contact is, what days you're there. A lot of folks are using email and social media here, right? So I just said all of those things: mailboxes, newsletters, displays. They need to see you every day. And the days you're not there, that's okay, but some presence in one of these forums are pretty good. A community walk. One of the things that people often leave out here, I think that's important, is a community walk means that you understand what's in the community that the kids live in. And if you don't live in that community, walk around it or take your car around it. Understand where the resources are, understand where the fast food is, or where the pool is, or where the after-school programs are, so you can become a repository of resources to help where folks are. I must have signed up to at least 24 different newsletters across the country for grants, trainings, webinars, and I just disseminate them to all the 70 different agencies in New York that we work with. And hey, this is happening, because I know what it used to be like to be a solo social worker. That's a different training that I do, looking at who's walking through the classroom door, how you really can set up your professional practice in a school. Kind of taking that and doing it in a school. Folks, how much time do we have? I'm happy to go through some of these slides, or we can stop here and just go to questions.
I think that you can cover up to 2:15.
2:15, okay.
Yeah.
Great, thank you. So I know I've been going fast here. We'll have 15 minutes of time. So I was asked to talk about the impact of COVID-19 on schools. I'm certainly not a national expert on it, but I can tell you what we've learned, what's out there in the literature, and some of the things that we've done in New York City to give you a taste of it. Here are some brief numbers as of Monday. You see the national numbers, close to 600,000 deaths across the country. I looked at Florida State, 36,000 deaths. Miami-Dade itself, over 6,000 deaths. Just to give us a moment's pause here, early data from the CDC also suggests that Black Americans are being hospitalized and dying at a higher rate than other racial groups. I'm sure some of you have experienced this personally, or know somebody who's experienced this, the racial disparities, the health disparities. Because of the death of Mr. George Floyd, we just had the anniversary that there's been a movement. And so we had the pandemic and the uncertainty, and then the rise of the Black Lives Matter important movement. And there was a sea change that happened. And so students want to talk about this. Families want to talk about this. Teachers, I'm not sure yet. I think there are some, and I guess it depends on the schools and how the schools understand it and treat it. But as clinicians and social workers, I'm sure all of us want to talk about this. We want to talk about it in an important way. And again, one of my mantras is do no harm. I'd rather have no services in a school than the wrong services. And a lot of times, the politicians want to throw in, let's put in another 100 social workers and we'll put in screenings and we'll do. Kids just want somebody to listen to, right? So it's just important that we all at least have that understanding. And what can we expect when we go back to schools if most of them are opening full time now? So again, why is it important to know historically housing residential segregation, overrepresentation in an essential workers group, lack of access and quality health care? I think many of you probably know that. There's a major loss of youth have lost parents, they've lost loved ones, they've lost family members, they've lost teachers, they've lost gym teachers, janitorial staff. So when students, some schools that you're working in may already be open, but everyone's looking to go all open in September when school starts. I think in Florida a little earlier than that. A lot of kids are going to be dealing with traumatic grief, right? We know grief and loss is natural. It's part of the life experience. But child traumatic grief pertains to children that are exposed or have a loss at a very early age. So we're really talking about young kids here. It should be careful to know we don't want to characterize. Not every child is going to be dealing with that. Our elementary school kids, not everyone is going to be dealing with it because kids are different. Resiliency, what kind of safety net do they have at home? You know, they can show similar signs of trauma and how they are dealing with it. As it says in the second bullet, traumatic death is one in which the child experiences unexpected, could be seen as gory or shocking. A death can be perceived by a child differently, certainly than an adult, and we'll go into that from a developmental point of view here. But it's more important to pay attention to the symptoms, the behaviors that you see. So this would be a perfect example of a kind of PD you'd want to do for teachers, a kind of, you know, intervention you'd want to help do, you know, trauma-informed with an equity lens types of group work, grief, loss, bereavement, time-limited types of groups. So we're starting to do that in New York City and getting folks trained up. Some of you may be familiar with this if you're looking at traumatic grief reactions, certainly preschool and young kids, right? Difficulty being soothed, maybe separation anxiety. They may regress to an earlier behavior. Like as an adult, when I regress, I might go for the ice cream, I might go for a drink, do something like that. I say, oh, my mind is too, you know, I've got too much on my mind, I can't think anymore. For a young kid, they may sleeping, eating, toilet disruption may happen. They may start sucking their thumb again, wet their bed. And that's a typical reaction that they're going to have to a traumatic grief response. School-age kids, we see this more maybe in nightmares. They want to avoid, they may become hypervigilance, right? And they may have excessive worries. Same thing with adolescents, but they may turn more to substance abuse and use and start to see their future as negligible. It's important when we work with students that there's some behaviors may be out of place or confusing. We don't want to be disrespectful, right? We want to look at the behaviors. We don't want to look at the child. It's not we're disappointed in the child, we're disappointed in the behaviors. How can we help it as adult? And what biases, whether it's people of color, Black, Latino, Hispanic populations, and other cultures, because they're different or because we may see them or label them as the other doesn't mean that they aren't suffering as much as you and I may be. So it's important to attune into that and get teachers to do that. Because of time, I'm going to move on. A lot of the things that we did in the New York City public school systems, we contracted with TREP out of Chicago. It's a trauma-informed care. It's a great 6 or 7 modules to get teachers to understand about trauma and its impact. A lot of telemental health was done and still being done. It showed a lot of flexibility that we could do with schools. Parents didn't have to have a 9 o'clock appointment. If they said, hey, I'm busy doing the laundry, we got to talk to them in the afternoon, evening. A lot of waivers happened, working with the State Office of Mental Health. And I think telemental health and virtual therapy is here to stay, particularly with a lack of psychiatric ability throughout, at least New York State and along the, from what I understand, across the country, the lack of child psychiatry. So doing mental health and teletherapy, I don't think is going away. And I think there's a lot of pros. There's also some cons, but that's for another time. One of the things we did in New York is also increase a school mental health campaign. All these posters, it came out of doing focus groups with students. They rather talk about mental health as pressure, as stress. We created all these posters with them in mind. We created trainings for teachers to do, an hour training. And once they took the training and they pass, they get a lanyard and they become like a mental health ally. Just as it's done with the LGBTQ community, I'm an ally and you'll have a rainbow tag. You get this lanyard. So we're trying to make more and more adults in the school become, help to destigmatize mental health, become a mental health ally, not to become therapists, but to understand where in the school services are done. And also, the last thing I'll say is that this summer, our summer school starts July 7th and goes through August 20th. We have Summer Rising, and what we did this year is opened up the school. We will open up the schools from 8 in the morning till 6 in the night. So the morning will be all academics, and the afternoon will be all activities, arts and crafts, sports, and that's where the mental health will be there. So they can do drop-in groups, they can do consultations, and for those who are doing in terms of the triangle, we're going to be doing a lot of universal interventions, but we will have mental health clinics on site in many of these schools to do that top of the tier, the targeted interventions. So I'm going to take a sip of water. I know I've said a lot. I apologize if I went a little too fast for you. There never seems to be enough time, but let's open it up, and I'm happy to take any questions or reiterate anything I went over or didn't get a chance to go over. So you can put them in the chat, and I think my host is going to read them out to me. Certainly there is my email. If you want to get in touch with me, tell me you took this presentation and you have some follow-up questions, looking for resources, any way I can help. That's part of my ethics, and I'm happy to, and I will respond.
Let me just make a reminder, for submitting questions, you have the question box. Now, sometimes kind of confusing because sometimes we use the word chat, but the question box is the right place to submit everything. And while we wait for questions, I'm going to read a comment that we received earlier, and it said, so hard to balance visibility and meeting with students, especially if someone is the only social worker on campus.
Yes, I don't know who you are, but my heart goes out to you. I started in this field. I used to call myself, I'm a lone wolf. I'm a lone wolf on this campus. And I'm juggling everything, right? Real time and school time. I'm sure you could do a presentation on that. So It's important that you get the support you need. And one of the things that I did once I became a director of some school-based mental health clinics, I remember what I went through. So we'd have weekly check-ins, we'd have group supervision. I made sure I could also offer trainings and PDs. And now, webinars, I must get invited to, 5 a day. There's so many of them. We'll see what happens next year. It is a balance. And I think the more effort you can do up front with the school, who are those school leaders? Who are the stakeholders? Who are the gatekeepers? Gatekeeping has various connotations. And one of those connotations is who's got the power? Who's got the final say? I was in a meeting once, one of those meetings where I had to get all your stakeholders, and I came in late. And there was this woman, and everybody was looking at her. And I said, how about this? How about that? They were all looking at her. And how about, and afterwards I said, boy, that principal has a lot of power. And they said, yeah, well, not really. I said, well, who was that woman they were all looking with? Oh, she's the head guidance counselor. She was there for 20 years. She had all the power. And the principal would ask, well, what do you think? So it's finding out who those folks are and getting into those meetings, being tenacious, lots of effort, sweetness. Like I said, hey, let's have lunch, let's have coffee. What can I bring you? How can I help you? Sometimes I'd go into a principal's office. They say, you work with school health? I need air conditioners because my kids have asthma. Great. Tell me how many air conditioners you need. I'm going to go talk to the director of school nursing. I'm going to put the two of you together. Now, I can't guarantee they're going to get air conditioners. But what I just got there was what I call frequent flyer miles, because you did somebody a favor. And someday you're going to need to chip in or get those frequent flyer miles and say, hey, I really let me show you the data. Let me show you how well you guys have been doing. Again, I think it's a little bit of a salesman, but I think it goes a long way.
Thank you, Scott. We don't seem to have any questions.
Okay. That's all right.
If you want to give folks a minute or two, if not, I just wanted to remind everybody as well that you have the handout, and on the handout tab, sorry, and you can just click download. And if that doesn't work, please make sure you email us and we'll send it to you through email. We do have another comment thanking you for the presentation and saying that it was excellent.
Okay, thank you. Even presenters needed some self-care once in a while. I appreciate that. I know on a Thursday afternoon, right before a long weekend, I appreciate your patience, and I hope this either encouraged you to do better, made you feel like I'm doing the right thing, or gave you at least some suggestions. And please do not hesitate to reach out to me. Again, I feel this is part of my job.
Thank you, Scott. You really have been excellent today. And I think we're gonna leave it at that.
Okay, leave it on a positive note. We all could use some positive feelings and good vibes, as they say out in California.
Thank you, Scott. And I hope everyone has a great day.
Thank you.